Hi, I'm Gavin NImon. I'm the lead clinician of the musculoskeletal program on the University of Adelaide fourth year program. I'm also an orthopaedic surgeon based at the Queen Elizabeth Hospital. I'm employed as a senior lecturer through the University of Adelaide. Myself and Peter Smitham are the two lead clinicians involved in teaching of the fourth year medical program. We coordinate the 6-week program along with Susanna Proudman, who's a rheumatologist. Today I'm going to actually go through what the program involves and how it actually is organised on the Canvas website. I hope this makes it a little bit more clear for you to understand. Generally, this program is a 6-week program and it involves a lot to learn in orthopedics and musculoskeletal in general. It's a lot packed in, and we don't apologise for that because there is a lot in orthopedics that needs to be known for medical teaching. 30% of your work, either in general practice or in other specialty areas, will involve orthopedics, and this may involve in primary care. You may get, as a general practitioner, see 30% of your work would be actually musculoskeletal. If you become orthopedic registrars or consultants down the track, which we would love, you obviously this will be full time for you, but also in any area of life, either be helping someone out in the street who collapses, or as a someone bystander in a motor vehicle accident, you might be exposed to orthopedics. Generally, though, most of us will actually be asked for just general chit-chat advice from our friends or colleagues or family members who may sustain an orthopedic injury. And in fact, the statistics are that 30% of the population will sustain a hip fracture later on in life. And a large number of us will go and develop arthritis in their hips or knees or shoulders and need a joint replacement. So hopefully this whole practice will be, or this 6 weeks will be useful for you. Now I'm going to go through what it actually involves and what you need to know, and also go through the Canvas site so you actually understand it. The program is an evolving program which has been developing for many years since I was a medical student, starting initially with Professor Bob Bors, who actually had his vision to actually have a good musculoskeletal teaching, developing through Dr. Tony Pole, and then through Melik Shahadi and Peter Smitham, and then myself, who has now taken on the lead role. A lot of us have been involved in it. Over this time, Professor Don Howie, who's recently received an Order of Australia award, has actually been overseeing this. And some of these people are now retired, but still help out in the teaching program, and you may be exposed to them during your training. This 6 weeks is a fair bit to know, but basically what you get out of it is what you put into it. We can only offer the services for you, so you can actually learn a bit about orthopedics. But if you don't do your best to go and see things and actually ask questions, you may not get as much out of it as you'd like. Certainly the actual attachments will be divided up into 3 different areas. There'll be the ward work, the theatre work, as well as the clinic work. And at the Royal Adelaide Hospital and the Queen Elizabeth Hospital, you may have a week on in one of those areas where you're predominantly on the ward or the theatre or in clinic. And really, you've got to try and get as much experience out of it. See as many operations you possibly can, see as many patients with the conditions that you're exposed to, or actually see how the patients are either present into the ward or how they recover from surgery. So hopefully you find this quite useful. During this time, you'll also be exposed to various workshops. In fact, the first day you'll be exposed to a scrubbing and workshop, which will prepare you to actually scrub into theatre and actually get a bit of experience in surgery, and hopefully get to do a few things, or hold some retractors, cut a few sutures, or even put a few stitches in if you're lucky. The scrubbing workshop is very important because this is a vital skill to have. And I would say that if you are unsure about how you can scrub, or if you have any concerns about it, feel free to grab some gloves, to take home a gown which has been a disposable gown which would normally be thrown out, and practice at home as well. Other workshops that are involved, we have anatomy sessions, which I'll run on a Wednesday afternoon, supervised by Ross Hamilton and assisted by our registrars who will help out with that. And they'll be divided up into 3 sessions: upper limb, lower limb, and spine. We also have a plaster workshop, which is always well received when the students get to practice plastering. And it's a good skill to have because a great way of reducing pain from an injury is immobilizing with a back slab or a plaster. We also have an injection workshop. During this time, you'll also be working with an orthopedic unit, but also exposed to rheumatology tutorials and clinics. And throughout the 6 weeks, we have the group of approximately 25 to 30 students we divide up into groups. Usually it'll be 1/3 will be at the Queen Elizabeth Hospital and 2/3 at the Royal Adelaide Hospital. And in that group, so for instance, usually it's about 8 to 10 students at the Queen Elizabeth and around about 24 to 30 students at the, uh, 16 to 20 students at the Royal Adelaide Hospital. There'll be 2 groups of 5 students at the Queen Elizabeth and 3 groups of 6 to 7 at the Royal Adelaide Hospital. And those 5 individual groups will be assigned to an individual consultant and to what we call Zoom groups. Now, this started from our COVID days and back in 2020 when we had to do a lot of teaching on Zoom sessions, but we've actually progressed it such we have a weekly tutorial, around an hour to an hour and a half each, where either 2 of 6 cases, which are rostered on the Canvas website, are discussed. So those 6 cases are shoulder, wrist, cervical spine, lumbar spine, hip, and ankle. And those cases will be discussed. In the 2 of those, each session will be discussed, such that 3 sessions will involve discussion of those 2 cases with the consultant. And the other 3 sessions, in other words, as a weekly orthopedic meeting, will be the other 3 of those 6 will be practicing examination techniques. So every week, the lead student in the group of 5 to 7 will be asked to contact the lead consultant to organise a tutorial where they'll either have a face-to-face or Zoom meeting to discuss 2 of the 6 cases, or go through the examination, either upper limb, lower limb, or spine examination, thus making up 6 tutorials over the 6 weeks. In the same way, those same groups will also be attached to a rheumatology consultant and will be asked to contact the rheumatologist to have several tutorials in that 6-week period. As well as these tutorials, which will be on the Canvas website, we will also be, you also have exposure to a rehabilitation workshop where you'll spend a day at Hampstead Centre, and later on down the track that may become repatriation, but at this stage it's Hampstead, and with an afternoon at a later date where you'll present a case to the rehab consultant and be assessed on that in groups. You'll also be exposed to a sports session led by Terry Farquharson, but assisted by 2 physiotherapists, and where you'll be presented with sports injuries and then be asked to prepare a sports presentation in groups, which will then be assessed by Dr. Farquharson. During this time, you'll also be asked to attend clinics and rheumatology clinics, but also have a weekly schedule for rheumatology where little mini quizzes will be assessed to obtain marks. And over the 6 weeks, there will be 3 main MSK quizzes of 50 questions each, of about 50 to 60 minutes duration, which you'll be asked to submit and then be assessed on that with a final MCQ question at the end of the attachment worth 25%. Thus, the 6-week attachment is assessed via the rheumatology quizzes, the sports injury assessment, the rehab assessment, the MSK quizzes, as well as a 25% final quiz, and also a rheumatology topic report, which you'll need to prepare a 1 to 2-page summary, which will be assessed by rheumatologists and worth 10%. The actual breakdown of the assessment is actually outlined on the front page of the Canvas website, which I'll go through in a few minutes. There are a few people involved in our program. I've already introduced myself and obviously Associate Professor Peter Smitham. I'm based at the Queen Elizabeth Hospital. Associate Professor Smitham is based at the Royal Adelaide Hospital, and we're the orthopaedic consultants involved in teaching. In rheumatology, Susanna Proudman leads the rheumatology group, and she's based at the Royal Adelaide Hospital, with Sam Whittle assisting at the Queen Elizabeth Hospital. Rehabilitation is coordinated by Ruth Marshall, along with her other rehabilitation consultants. And the sports injury team involves Terry Farquharson, James Schomburg, a physiotherapist, and Mustafa, another physiotherapist who will help out with James, both who are based in private, but are given their time to assist in the sports teaching. The anatomy workshops are run by Ross Hamilton, a senior lecturer at the university, and they're assisted by the registrars. And the plaster workshops are coordinated by Jackie Sullivan and Tony Penn. Tony's based at the Queen Elizabeth Hospital, Jackie at the Royal Adelaide Hospital, and they'll coordinate a plaster workshop day. Obviously, we acknowledge this great assistance by the Adelaide University Sim Labs. And we also have assistance from a radiologist. At this stage, it's Ash Hatwell, who actually will coordinate a Zoom meeting and divide the 20 to 30 of you into groups of 3, so that there'll be sections of approximately 8 to 10 students will log on a Zoom webinar, and he'll present cases to you, so you can get experience in interpreting radiological investigations of the musculoskeletal injuries. Now I'm going to go to the campus website, and so I'm going to share my screen now. And this should be, you should see our campus website here. Now, this is the home page. This is slightly different to what was the campus website last 6 months, or the first semester, but it's got exactly the same equipment information on it, but it's just been rearranged slightly to make it a little bit easier to understand. And I really thank the assistance we've had from the Dean, as well as the fantastic assistance from our 6-year medical student, Ella Obst, who helps reorganize this website. And she did a great job in reviewing the user interface and readjusting it to make it more user-friendly. Now, the main page will have this video, which you'll be able to see, and we've got the other information, such as the basic idea of the Start Here page, which will take us through to the first day of interactions, including scrubbing workshops, the instructors, which will outline the people I've already mentioned, the timetables where the precinct officers will load this up, and I should take the liberty of introducing the precinct officers. At this stage, it's Vicky, who's based at the Adelaide University Med School, who coordinates the central project through, i.e. the students at the Royal Adelaide Hospital. And then we have Kemma and Katrina, who are based at the Queen Elizabeth Hospital precinct office on the 2nd floor. Now take your time to introduce yourself to them, and they're fantastic help through and assistance for this whole program. And they'll coordinate timetables from this timetable section. And we have this breakdown of the assessment, which again you can see here, outlining the quizzes, which involve the rheumatology quizzes weekly and the 3 main MSK quizzes throughout the 6-week program. We have our rheumatology short topic report, our rehab assessment, our sports injury assessment, and our final MCQ 25%. Now, you may ask about this 20% key clinical examinations workshop logbook. There'll be a logbook that you'll need to download from the front page, which will ask you to sign off on key examinations and workshops, such as the plaster workshop and injection workshop, etc., as well as make sure that you attend clinics and theatres, and you'll be assessed on your attendance and interaction in those as well. That is a hurdle part of the assessment, and it's very important this is filled in and then reloaded back up for your mark. If we go back to the home page, I've outlined the main program on this front page. Now, I would say that the syllabus can be obtained through this one download of the course schedule, and that will download a course syllabus here in a PDF file, which you will see will open the main information that you need to know. It's divided up into dark blue, which is key knowledge, red, which is things you should know about, orange, know about, but not in significant detail, and black is just really used for titles. So it's really the main things are the dark blue information, but with red with some information to assist you. It's divided up into 13 different pages. And unfortunately, orthopedics does involve a large part of medicine, and this will seem initially daunting, but you will find once you start seeing and actually seeing patients and operations that really the same things start reappearing. Medicine's a bit that way, that they all interact and start looking like you're seeing the same thing repeating itself, because most of the conditions do actually interact. It's probably hard to explain that until you actually see the MSK conditions, but you'll see what I mean. For instance, if we look at the main key areas of orthopedics involves arthritis or degeneration, and the same process that occurs in the shoulder occurs in the hip with arthritis of the joint, or degeneration of the tissues around the joint, such as the labrum. If we go back to the main page, the course schedule is also outlined in this main folder or page, and I've divided it up. Now, people ask which textbooks you should use. The main key textbook is Apley's, and this is the one I like personally. If I was actually preparing to learn orthopedics, I would use Apley's and download the chapters from it, highlight the areas I think are important, and use that as my basis for learning. Peter Smitham himself actually prefers the ortho bullets, which involves dot points and the key aspects. Rather than trying to read chapters after chapter, he likes the dot points, which helps reinforce your teaching or what you've been taught. And both have got their benefits, and really you've got to find which works for you. But as part of that, we have actually divided the key aspects into these different modules in this area. And this starts off with the fundamental topics, such as the global burden of disease, which outlines how extensive musculoskeletal injuries are and rheumatological injuries are in the society. And then the osteoporosis leading to fractures, or osteoarthritis leading to degeneration. Talks about examination skills, principles of fracture healing, principles of operative management, and radiology. And this is the area where radiology will be placed. So if you want to, in preparation for the radiology tutorial run by Ash Hatwell, this will be on this list here. Then we have a section about pain management. We then divide it up into the regions: upper limb, lower limb, and spine, with general information about those conditions, examination factors, and also the anatomy sections, which is a pre-reading prior to your anatomy workshops. The rheumatology runs concurrently with it all, divided up into 6 weeks, with the initial introduction, the main quizzes at the top, with small quizzes alongside on a weekly basis, and the cases that will be expected for you to review to help you learn your rheumatology. It keyed off from the central section. The workshops are based into this area here. There's a principle of the procedurals as a download, as a little handout, but the main scrubbing workshop, injections and aspirations and plastering workshops are keyed off from this area. Then we have our rehab and sports medicine section in this area where you can download your pre-reading and prepare for your assessments from that. With the emergency topics, the serious things, the emergency scenarios, the infections, the tumors, and the overview for that. And orthopedics and rheumatology also involves a lot of research. And there is a section here coordinated by our basic scientist, also under physiotherapist graduate, Tiffany Gill, who's also another key teacher in this program. And she's coordinated information on basic science, biomechanics, and biostatistics. As part of that, part of the program also offers an additional ability to actually get involved in research. And Peter Smitham runs a regular Thursday night meeting or ad hoc meetings to discuss research options and possibilities. And many of our undergraduate medical students have been involved in that and have actually come away with their names on papers or presentations, which will help them in later career progression. And you can speak to Peter Smitham or assisted by Tiffany Gill regarding that. The information about the Zoom tutorials is based here. The orthopedic Zoom tutorials are listed in this part, and the rheumatology examination groups are in this part. And then the key part, the part that most medical students want to know about, is the assessment. And that's down here. It can be accessed through this section with the downloads of the logbooks and the key examination workshop logs here, which are submitted through these sections. The main orthopedic MCQs here, the rheumatology topic report section here, and the summative MCQ, which is held on the last 24 hours of the 6-week program. The rest of all the other assignments are due by the end of the 6 weeks. So they should be submitted by the last day, or at least the last weekend. So I would normally give the end of the Sunday of the last weekend for it to be submitted. Now, the online part of the course, you'll be used to the quiz and assessments having a due date. With so many different assessments, to adjust the due date 6 times a year involves a lot of work. So I usually just leave this open and don't put a due date on the assessments, but expect that the assignments will be submitted by the end of the 6 weeks, the weekend afterwards. The MCQ, the 25% MCQ, however, is made open and available for assessment from the midnight on the Thursday night before the last day until the Saturday night midnight. So 48 hours to submit it. And that's approximately a 60-minute quiz, which you've got, which is worth 25% of the assessment. So there's a lot of information. There's a lot to take in. Please, one of the reasons I particularly liked orthopedics and I aspired to be an orthopedic surgeon is actually when I was going through your level and also years following, I always found the registrars, the interns, the consultants all very friendly and easygoing and more than happy to help out. And I like their nature. Now, a lot of doctors you'll come across in the hospital, hopefully exactly the same, but we would hope that you would find this nice experience from orthopedics. But please, if you've got any questions, don't hesitate to email me or you can text me through the system or go through the precinct offices and email a question to them. But a lot of our answers will be listed on the Q&A section of frequently asked questions on our front page here. And some of these questions will keep reappearing. So before you ask me a question, you might want to just check this frequently asked questions section at the top of the page. But if there are any issues, please don't hesitate to contact myself or Peter Smitham or any of the precinct officers, and hopefully we'll be able to answer them for you. Look, I really appreciate your being involved in our program. We hope you enjoy it. I hope you find it that you learn a lot. But please try to put as much into it so you can get as much out of it. And once again, welcome to fourth year medicine, MSK.